Assalamualaikum warahmatullahi wabarakatuh. Yang saya muliakan Puan Wan Fatimah Wan Daud, Ketua Jabatan Perkhidmatan Kejururawatan Hospital Chancellor Tuanku Mukhris, yang berusaha KJ Masilawati yang telah menghubungi saya untuk sesi CNE pada petang ini. Hadirin hadirat, pertama sekali saya ingin memperkenalkan diri saya. Saya adalah Dr. Faiz bin Daud daripada Jabatan Kesihatan Masyarakat Fakulti Perubatan. Tajuk yang telah dipersetujui oleh KJ untuk dibentangkan pada petang ini adalah Influenza Pandemic, Role of Non-Pharmaceutical Intervention, or in short, NPI. Okey. Ini adalah poster yang telah dikeluarkan oleh Kementerian Kesihatan Malaysia yang menunjukkan amalan-amalan norma baharu yang perlu dilaksanakan dalam kehidupan kita sekarang. Jadi antara amalan-amalan yang diketengahkan di sini termasuk 3W dan juga elak daripada 3Cs. Okay. The 3Ws are wash, okay, washing your hands, wear, okay, wearing a face mask, okay, and the third W is warn, okay, give warning to others, okay. Dan perkara yang seharusnya dielak adalah 3C. Number 1 would be crowded spaces, number 2 confined spaces, and number 3 close conversation. Jadi ini semua antara amalan-amalan baharu demi memutuskan rantaian COVID-19. Jadi pada petang ini, apa yang kita akan cuba buat adalah untuk merungkaikan apakah asas kepada amalan-amalan yang diketengahkan ini. Dari manakah amalan hand hygiene, amalan memakai face mask, pelitup muka, di manakah amalan social distancing, okey, daripada mana datang semua ni. Okey, jadi petang ini kita akan cuba kenal pasti, okey, bagaimana amalan-amalan ini diketengahkan oleh pihak Kementerian Kesihatan. Next slide. Okay. So, NPI or non-pharmaceutical interventions are actions apart from getting vaccinated and taking medicines that people and communities can take to help slow the spread of illnesses like pandemic influenza. So basically it means that what are the actions, okay, langkah-langkah apa yang kita boleh laksanakan, okay, selain daripada ambil ubat, selain daripada mengambil vaksin, okay, demi ataupun untuk mengelak ataupun membendung penularan sesuatu penyakit. So NPI is also known as a community mitigation strategies. Okay, di NPI adalah langkah-langkah strategi, langkah-langkah amalan yang patut dilaksanakan oleh masyarakat umum, bukan hanya oleh healthcare workers, okay, tetapi daripada masyarakat di sekolah, masyarakat di tempat kerja, mahupun masyarakat di rumah. So when a new when a new flu virus spreads among people, causing illness worldwide, it is called a pandemic flu. Okay, that is what we are seeing now with COVID-19. And because a pandemic flu virus is new, okay, human population has little or no immunity against it. Okay, tak ada immunity. Jadi apa yang kita perlu buat adalah mencari ubat. Okay, tapi masalahnya vaksin ni belum ada lagi. Ubatnya pun belum diketengahkan lagi. So NPIs are among the best ways of controlling pandemic flu when vaccines are still not yet available. So saya dengan tim saya telah melaksanakan systematic review berkenaan dengan isu non-pharmaceutical intervention. Oleh yang demikian, kita ingin melihat apakah artikel yang telah diterbit jangka masa 20 tahun kebelakangan ini, sejak tahun 2000 hingga 2020, isu yang berkenaan dengan non-pharmaceutical intervention untuk mengelak daripada suatu pandemic influenza. So these are some of our keywords. Okay, if you can see on the top left hand corner here, okay, these are the people or the population involved. Okay, the keywords includes human, people, man, individuals, mortal, society, community, homo sapiens, humanity, man, public, population. Okay, ini semua menggambarkan sebuah populasi iaitu humans. Okay, the next column would be I. Okay, this is the intervention. So the intervention that we are interested here would be a non-pharmaceutical intervention. So non-pharmaceutical intervention includes hand hygiene, hand washing, social distancing, mask, N95, surgical mask, personal hygiene, personal cleanliness, social distancing, self-isolation, stay at home, self-quarantine, quarantine. Ni semua istilah-istilah yang kita dengar hari-hari lah. Okay, so ni semua intervention or keywords that we include in the search strategy. The thirdly would be the outcome. Outcome apa yang kita inginkan daripada all this NPI? Okay, flattening the curve. Okay, saya pasti semua pernah dengar ni ya. Decrease cases, reduce morbidity, reduce mortality, decrease incidence. Of course, obviously kita nak kurangkan case, kurangkan hospitalization, kurangkan admission, kurangkan outbreak, okay, kurangkan pandemic. Okay, selain daripada itu juga kita juga ingin melihat publication yang melibatkan ataupun mempunyai istilah-istilah seperti MCO, Movement Control Order, PKP, okay, circuit breaker, lockdown, restriction order, closure. Okay, semua istilah-istilah ni berkait rapat dengan non-pharmaceutical intervention. Okay, so yeah, these are some of the inclusion and exclusion criteria. The inclusion criteria in our systematic review includes a 20-year period. Okay, so kita akan lihat semua jurnal yang diterbitkan daripada sejak tahun 2000. Okay, only in the English language. It would be peer-reviewed articles and it will only include full text articles. Okay, among the exclusion criteria in this systematic review were animal studies or vaccination-related journals, okay, and a hospital setting. Kenapa kita exclude hospital setting? Because we know that for sure healthcare workers, okay, I believe that we are all very good in adhering to the SOPs in our workplace. I always tell my colleagues that hospitals are among the safest place, okay, because we have a full set of regulations, full set of SOP which everybody will follow. Okay, the nurses, doctors, pharmacists, attendants, clinics, cleaners. Okay, they will also follow all these guidelines. So that is why kita excludekan dia daripada this systematic review. Okay, there were several databases that we looked at, includes Ovid, EBSCOhost, Scopus, WS, and others. So we found a total of 208 articles. So how do we reduce or downsize the number of articles? Is by following the Prisma flow diagram. Okay, from the initial 208 potential relevant citations identified, we remove 41 duplicates. So we are left with 167. Okay, from this 167, we screened out 86, okay, which were studies which were irrelevant population. Okay, kita nak tengok hanya studies ataupun kajian yang dilaksanakan di dalam kalangan manusia. Okay, 81 full text articles were retrieved and screened. Okay, 67 were excluded, and therefore we have 14 articles included for the narrative synthesis. So untuk pembentangan hari ini kita akan bincangkan sebanyak 14 artikel. Ya, saya akan petik intipati sahaja untuk kita kenal pasti apakah non-pharmaceutical intervention dalam menangani pandemic influenza ini. Okay, these are some of the Excel forms that we had, okay, whereby we started off with 208, reduced to 167, 81, and in the end we had 14 articles that we go through. All right, the extraction table is a summary of all the 14 articles that we have gone through. Okay, so this would be in this form. Okay, so we try to understand the sources, okay, the study design, the population of the participants, the preventive measures, rate of effectiveness, and the main findings, and we'll come up with the conclusions as well. Okay, these were all done in the Excel sheet, okay, in the Excel spreadsheet. This is a print screen of what we have gone through. All right, so let us go to the findings. Okay, as a whole, okay, we identified 14 articles, okay, and out of these 14 articles, they have we can divide it into three main categories. Okay, number one would be the human surveillance. Okay, many of these articles touch on human surveillance, okay, in the aspect of hand hygiene, disinfection, cough etiquette, okay, the usage of face masks. The second category that we found was about patient and contact management. Okay, how do we deal with the patient? How do we deal with the people who have contact with a positive case? Okay, so this include social isolation, okay, quarantine, contact tracing, and voluntary sheltering. Okay, voluntary sheltering basically is home isolation ataupun home quarantine. Maksudnya dia rasa dia terdedah kepada pesakit yang positif. Oleh demikian dia mengambil keputusan untuk quarantine dengan diri sendiri. Okay, so that is voluntary sheltering. And we have community restriction. Okay, community restriction ni termasuk closure of facilities, tutup sekolah, tutup hospital, tak boleh tutup lah, tutup surau, tutup masjid, tutup tempat apa ni, shopping mall, untuk okay, cancellation of group events, kenduri, kendara semua dibatalkan, solat jemaah pun tidak boleh, okay, di tempat di surau dan masjid. Okay, travel restrictions, yes, I think this comes about another community restriction. Okay, so these were the main three aspects that we noticed, that we gathered from the from this systematic review. Next. Yeah, again. So for human surveillance, we had a total of 9 articles. Patient and contact management kita ada 2, community restriction kita ada 2, and a combination, okay, whereby the study looks into a combination of patient and contact management as well as a community restriction. So we had 1 paper on that. Okay, so all the 14 articles, okay, that we gathered came from 9 different countries. Okay, so we had 2 articles coming from Thailand, okay, another 2 from China, 1 from Australia, 2 from Taiwan, 1 from Israel, 3 from US, and 1 each from Finland, Egypt, and Germany. So I think we have covered the breadth of this review, whereby we have participants, or we have inclusion of all the continents in the world. So let's just have a look at the first one, which is the human surveillance. Okay, so Apisan Tanarak, okay, in 2009, okay, they studied among 240 preschoolers. Okay, these are children in age of 5. Okay, perkara apa yang dia assess adalah 3 perkara. Number 1 is hand hygiene, number 2 cough etiquette, and number 3 a combined behavior. So what was found is that they have done this in 3 different period. Okay, the first period, okay, where they had on 25 cases per 1,000 children days. Okay, period number 2, they had 10.1 cases, and period number 3, they had 8.2 cases. So there is a reduction in each period. Okay, so period 1, they only conduct hand hygiene. Okay, dia suruh kanak-kanak ni buat hand hygiene saja. So tengok, okay, ada 25 case daripada 1,000 kanak-kanak. The next one, they said, okay, you just conduct cough etiquette, cara batuk yang betul, maksudnya tutup dengan tangan ataupun tutup dengan siku. Okay, so mereka dapati ada 10 sahaja case daripada 1,000 kanak-kanak. Dan apabila digabungkan amalan hand hygiene dan juga amalan batuk, didapati 8 cases. So there is a further reduction there. Okay, so this was in Thailand. So let us have a look what was done by Cowling in 2009 in Hong Kong. Okay, so in Hong Kong, okay, what they did was they had a lifestyle education, okay, and then they compared with hand hygiene and the usage of surgical mask. Okay, so they found out there were fewer infections among participants using face mask plus hand hygiene. Okay, so maksudnya di kalangan peserta kajian di Hong Kong, okay, kalau mereka pakai face mask dan juga melaksanakan hand hygiene, okay, so there was a fewer rate of infections. Okay, so again, this was done at 45 outpatient clinics. Okay, so basically this involved households. And third one by Lau in 2012, which was a cohort study. Okay, this was done in elementary schools, which sekolah rendah. Okay, so they noted that, okay, both the percent total absent days and percent illness related absent days were significantly lower in the group receiving short instruction during flu seasons. Okay, so basically group yang dapat instruction untuk melaksanakan hand hygiene, they had less people with flu. Okay, however, it was noted that the teachers agreed that hand hygiene is not performed properly among students and reported time constraint as a barrier. Yalah, nak laksanakan basuh tangan dekat sekolah, banyak perkara yang perlu difikirkan. Okay, nak buat sinki, nak tarik air, nak basuh dengan sabun. Okay, tapi the schools in the US, they have shown that almost 1,000 students, with dengan melaksanakan hand hygiene, walaupun hand hygiene itu tidak dilaksana dengan sempurna, telah berjaya untuk mengurangkan kes flu during that season. Next. Okay, seterusnya, Zimmerman et al. In 2011. Okay, this was another randomized control trial. Okay, this is involved a larger number of participants, 1,500. Okay, so they found that there was not significant difference among the control group and those doing hand hygiene. Okay, so Zimmerman was the only study which states that influenza transmission was not reduced by intervention to promote hand washing and face mask use. Again, this was in Thailand. Okay, so what does Suez say in 2012? Okay, in 2012, Suez did a study in Germany. Okay, again, they look into the practice of hand hygiene as well as face mask. Okay, and what they found was when analyzing only intervention group, secondary infection was pooled M and MH groups was significantly lower compared to the control group. So basically, what they say that the non-pharmaceutical intervention may be effective in preventing transmission of influenza in household. Okay, so you can see that 2011 Zimmerman kata dalam population dia dekat Bangkok 1,500 people, nope, there is no difference among those doing hand hygiene and getting influenza. However, Suez in Berlin said there may be effective. Okay, so let us have a look at what does Alilo et al. 2012 says. Okay, Alilo in America, they also assess hand hygiene and face mask, shows a significant reduction in the rate of influenza-like illness among participants with face mask and hand hygiene intervention. So these non-pharmaceutical measures should be recommended in crowded settings at the start of an influenza pandemic. Okay, so Alilo pada 2012 memang menyatakan ada signifikan kekurangan yang signifikan di kalangan 1,100 young adults living in universities resident halls. Okay, so ini antara asasnya kenapa kita laksanakan hand hygiene dan juga pemakaian face mask. Seterusnya, Stebbins in 2011, juga di Amerika, they have a larger number of participants here with 3,000 plus. They also assess hand hygiene and cough etiquette. They said that NPI, respiratory hygiene education, and the regular use of hand sanitizers did not reduce total lab confirmed influenza. Dia katakan maksudnya tak ada kekurangan in terms of respiratory confirmed influenza. However, the intervention did reduce school total absence by 26%. So there is an observation that was made, that by conducting hand hygiene and proper cough etiquette, more children are able to come to school. Less children are being absent due to influenza. So that's a positive side. Okay, talaat 2011 juga. Okay, this was done in a huge number, 20,000 students in Egypt. Okay, and apa yang dia assess hanya hand hygiene saja. Okay, so what was the findings? An intensive hand hygiene campaign was effective in reducing absenteeism caused by these illnesses. Okay, so with a very large number of sample, okay, or participants, okay, of 20,000, okay, they Talaat at all says that, okay, kita dengan pelaksanaan hand hygiene, lebih ramai pelajar akan hadir ke sekolah. Okay, so let us have a look in 2012, Salvo Lainen, Copra and all. Okay, they conducted a study in private companies, okay, in Finland. Okay, what do they assess? Again, hand hygiene with soap, and they compared it with alcohol-based hand rub, yes, hand sanitizer yang kita guna juga. Okay, so in the total follow-up period, there was a 6.7% reduction of infection episodes, okay, in the soap and water arm. So we concluded that intensified hand hygiene using water and soap together with behavioral recommendation can reduce the occurrence of self-reported acute illness in common work environment. So kita lihat di sini di Finland, okay, mereka laksanakan intervention hand hygiene among the adult or working people. It was proved to reduce. Among schools going children in Egypt, among the elementary school or school sekolah rendah, okay, we also confirm that there is a reduction in absence. So ini semua menyokong kepada amalan hand hygiene dan juga pemakaian pelitup muka. Next, okay, we come to the patient and contact management. Okay, so this comes with for the second group. Okay, 2007, Hishe. Okay, they did an observation in Taiwan. Okay, this was in particular during the SARS outbreak. Yeah. Okay, so their study involved 150,000 people, and they were assessing the level of quarantine. Okay. Level A quarantine versus level B quarantine. Okay, level A quarantine prevented approximately 461 additional SARS cases. Level B, around 5% reduction of cases. So by comparison, a perfect level A quarantine, which aimed to quarantine all asymptomatic cases as soon as they were potentially exposed, results in more drastic reduction of cases than a perfect level B quarantine. So basically they are saying here is that level A quarantine ni adalah orang yang tak ada symptoms tapi dia quarantine kan juga. Okay, these are asymptomatic. Level B are people who are symptomatic, baru dia quarantine. So they would like to see what are the difference, and obviously they show that level A quarantine have a more or manage to prevent high cases of infection and death. Okay, Wang et al. 2007. I think I believe they shared the same respondents because the number was about 147,526 person. Okay, these were people placed in quarantine. Again, they used the same definitions of level A quarantine and level B quarantine. So it is interesting to note that quarantining only persons with known exposure to people infected with severe acute respiratory syndrome could have reduced the number of persons quarantined by approximately 64%. So in short, it means that they're saying that we, if we quarantine more uh, people with who are known to be exposed, okay, um, therefore they can reduce the number of persons being of other people being quarantined. All right, so this is the same thing. Okay, next would be the third one, which is community restrictions. Okay, this is the one that another big issue that we face. Okay, so let us have a look at some of the community restriction. Okay, kenapa dia tak tukar? Okay. Heyman 2009. Okay, this was a study observed in Israel. Well, it came up in our systematic review, so there is something to learn, okay, from what was found in Israel as well. 6 to 12-year-olds, household members aged more than 12 presumed to be living with children. Okay, what they did was they assessed the activity of closing the schools. Tutup sekolah. Macam mana apa ni, kita tutup sekolah bulan 3, 4, 5, 6. Okay, baru-baru ni bulan 7 baru dibuka semula. So 4 bulan tutup sekolah. So apa yang Heyman found was that school closure should be considered part of containment strategy in an influenza pandemic. So kesimpulan yang dia bawa adalah bahawa memang penutupan sekolah merupakan satu langkah yang patut diambil, bukan setakat langkah yang patut diambil tetapi juga langkah awal, okay, as a containment strategy. Okay, so containment strategy ni adalah strategi yang kita buat di peringkat awal satu epidemik atau pandemik berlaku. Okay, seterusnya Effler 2010, another observational study in Australia. Okay, so it was also assessing the practice of closing schools. Okay, is that of 221 contacts and peers, 19 or 9% reported onset of respiratory symptoms during the week of school closure. 14 were contacts and 5 were peers. So illness in 6 of the symptomatic students, 3 contacts and 3 peers met the criteria for ILL. The remaining illness were URI. Okay, so basically what it states that 90% of the parents said that okay, sekolah tutup tapi their children had minimal anxiety or no anxiety at all. Okay, however, okay, ibu bapa lah yang punya apa ni, yang terkesan, ya. 55% reported that school closure caused moderate and severe disruption to family routines. Sebab inilah parents, mak, ayah, anak ada kat rumah, kena ambil bahagian, take turns. Hari ni suami jaga, esok isteri pergi kerja, lusa, macam itulah. So it disrupts the family structure. Okay, however, that is only among 55%. So that was the observation made in Perth, Australia. Okay, seterusnya a combination method, yeah. Okay, so we got one paper by Butley in 2004. Okay, so this was an observational study during the SARS outbreak. Okay, and it involved assessing the quarantine, assessing the closure of facilities, okay, as well as transit site surveillance. Okay, so maksudnya dia combine kan kesemua tadi, yang human surveillance, dia combinekan patient contact management as well as community restrictions. Okay, so apa yang Bartlett bertemu adalah, okay, 2,000 quarantine close contacts, attack rate was 6.3, whereby 15% among spouse to 0.36 among works and school contacts. The attack rate quarantine house members increased with age from 5% in children less than 10 years. Okay. So in conclusion, all public elementary, middle and high schools, okay, the 2,000 of them, 600 were closed, not reopening again in some time cases in early June. So in early July. So kita tengok pun dia tutup pun lebih kurang 3-4 bulan, bulan 4, 5, 6, 7. So lebih kurang 3 bulan. Kita pun dekat Malaysia ni lebih kurang so happen bulan 3 tu memang cuti sekolah, okay, dan dilanjutkan kepada bulan 4, bulan 5, bulan 6 and then bulan 7 mula balik ya. So Bartlett found out that the multiple control measures implemented in Beijing likely led to the rapid resolution of SARS outbreak. Okay, he's saying that the multiple control measures, di mana dia adakan quarantine, dia adakan closure of facilities, dia adakan surveillance. Okay, so all this helps in reducing the spread of SARS. Improvements in infection control practices, use of PPE, grouping of patients with SARS in the hospital, establishment of designated fever clinics, quarantine of high-risk close contacts, improved public information and awareness of SARS likely played important roles in controlling the outbreak. Okay, so kalau kita rumuskan dekat sini bahawa Bartlett in 2004 menyatakan bahawa semua perkara ni, okay, kita buat sekarang. Okay, kita buat sekarang di Malaysia. Okay, kita guna PPE, yes. Kita groupkan patient dengan yang ada COVID, COVID, non-COVID, yes, kita buat. Establishment of designated fever clinics, yes, kita ada buat triage center, PUI center. Okay. Quarantine high risk close contact, betul, okay, kita ada buat juga. Even di kalangan staff kita pun, kalau kita ingat waktu saya bertugas di bilik gerakan COVID dahulu, kita keluarkan poster yang menyatakan kontak pada zon 1, zon 2, zon 3, zon 4 dan definisi-definisinya. Okay, so kita quarantine kan, ada yang kita sediakan quarantine di rumah, siapa yang tak boleh kita quarantinekan di asrama. Improve public information, dan kita laksanakan informasi melalui pelbagai medium. Kita ada bulletin COVID, kita ada telegram, kita ada email, okay, dan WhatsApp group. Okay, so semua langkah ini Bartlett setuju telah mengurangkan the rapid resolution, the rapid spread, okay, ataupun the reduction, okay, of SARS at that point in time. So our recommendation and conclusions states that, number one, a non-pharmaceutical intervention plays an important role in influenza pandemic management and prevention. Number two, many studies were carried out contribute to the growing body of knowledge of community behavior during such outbreaks. So kita in containment stage, kita boleh letak semua pesakit di hospital. Tetapi apabila PKP, MCO telah berakhir dan kita perlu community ataupun masyarakat untuk melaksanakan norma-norma baharu ni. The result of our systematic review may be helpful to public health and education officials considering NPI as means to control influenza outbreak. These studies may help estimate the effects of non-pharmaceutical intervention during infectious disease outbreak as a disease mitigation measure and underscores the need for further research. Yes, waktu kami buat systematic review ni kita dapati bahawa sangat sedikit research yang dilaksanakan di kalangan community, okay, di hospital ada banyak, okay, among healthcare workers, among patients, in hospital settings memang ada banyak, tapi di community, ya. So dalam situasi pandemik sekarang ni kita perlu lebih research, lebih kajian di pihak community, kerana COVID bukan hanya berada di hospital tetapi ianya menular dan berleluasa di masyarakat kita. Dan terakhir sekali, NPI with the aid of effective vaccination programs and research on antivirals are equally important to combat pandemics. So kita nyatakan bahawa di sini of course memang kita inginkan vaccination, memang kita inginkan ubat antiviral, walau bagaimanapun dengan kekangan yang ada, dengan sumber yang ada, kita perlu meneruskan agenda non-pharmaceutical intervention, terutama sekali pemakaian face mask dan hand hygiene di kalangan masyarakat kita. Ya, saya ada akan kongsikan nanti ada short video sebelum kita berakhir, and these are some of my references. Okay, and thank you. Sebelum kita akhiri, saya mungkin nak kongsi sedikit poster. Ya, saya pasti yakin ada sebilangan daripada kita pernah melihat poster ini yang dikeluarkan oleh Bilik Gerakan COVID, Hospital Chancellor Tuanku Mukhris, berkisar dengan zon kontak COVID, ya. Okay, so zon 1 adalah pesakit COVID positif sendiri, zon 2 adalah di kalangan masyarakat, keluarga dan juga staf kaki tangan hospital yang tidak memakai PPE lengkap. Zon 3 pula adalah staf atau kaki tangan yang ada kontak dengan zon 2. Okay, mereka in the initial stage mereka dikuarantinkan dan diberi cuti CJ MC. Dan zon 4 di mana mereka ada kontak dengan pesakit dengan orang di zon 3. So zon 4 ni jangan risau, work as usual. Okay. So ini adalah antara poster-poster yang telah dibangunkan oleh pihak Bilik Gerakan. And lastly, before we end, I believe you would benefit from this particular video. Sama-sama kita hayati video ini. Okey, baiklah. Itu merupakan rumusan kepada kita punya sesi pada petang ini. Oleh demikian, saya yakin dan pasti kita sebagai healthcare staff, okay, perlu memberi peringatan kepada masyarakat di luar sana, okay, agar amalan ini diteruskan, okay, iaitu wear mask, wash, hand hygiene, dan juga warn, okay, sebagai apa, tidak bersalaman. Saya mengambil kesempatan ini untuk mengucapkan salam Aidil Adha dan selamat bercuti. Assalamualaikum warahmatullahi wabarakatuh.